Hi, today I would like to speak to you about constipation in babies who are breastfed and in babies who are bottle fed with formula. There is a difference. Babies who are breastfed have less chance of becoming constipated. And if they do become constipated, their stool stays soft. And so it's always for them easy to eliminate the stool, to expel the stool, because it doesn't really hurt, or it's not so difficult to expel them. In fact, as you can see, breast milk in the stomach has tiny little curdles. It stays liquid. And it stays liquid throughout the digestion in the small intestine up until whatever remains, the residue that will be expelled in the stool, stays liquid or semi-liquid up until the time when it gets slowly to the sigmoid and to the rectum. So the stool of a breastfed baby is always soft, easy to be expelled. The baby who is breastfed can hold the stool for days, sometimes for a week. So even the breastfed baby can become a bit constipated in the sense that he has less bowel movements, but for a breastfed baby, constipation does not become an uncomfortable problem or a very uncomfortable problem. So we won't do anything about breastfed baby who has constipation. On the contrary, in a baby who is bottle fed, the formula milk has a chance of becoming harder and harder when it goes to the rectum through the usual pathway. It goes to the colon, to the rectum, and if it stays there long enough, for some reason the baby holds the stool, the stool becomes quite harder and harder, and difficult to expel, to the point of hurting the anus and the rectum of the baby when it goes out. So the baby has a painful experience that remains in his memory, and he will start holding the stool more and more, getting into a vicious circle. The more he holds the stool, the harder the stool becomes, the more difficult it gets to, and the more pain it causes during the bowel movement, and the longer the baby will keep the stool in. Can we do something about it? Yes, actually we should do something about it quickly, because we don't want the baby to become used to the idea of holding the stool, because the stool is difficult to expel and causes pain. What can we do? We can give the baby, putting it into the formula, substances that keep the stool soft by osmosis, by holding water in them through the mechanism of osmosis. These substances are macrogol or lactulose. They are not drugs, they're not medicines. They are substances that can be given also in large amount if needed, to try and keep the stool, and they do succeed in keep the stool soft. The more you put into the milk, the more the stool will become softer. The effect of this stool softener, macrogol or lactulose, though, make sure you understand this, is not immediate, like laxatives that were used in the past, or like suppositories or enemas. The effect of the stool softener comes after days, sometimes weeks. a week or two. And then when it starts working though, it becomes more and more effective. The stool becomes softer and softer. The baby can have regular bowel movements without pain, and she avoids the vicious circle I was talking about before. The vicious circle of the stool is hard, it hurts, and I don't want to have a bowel movement. The trick is, first of all, wait for the effect of these stool softener. Two, when the baby is has finally resolved the problem, don't immediately stop the use of the stool softeners, because the baby may go mentally back into the vicious circle. Keep on giving this stool softener for periods of weeks, couple of months, 2-3 months. The baby will forget the painful experience he had with the very hard bowel movements, and will solve the problem entirely.